Hello, I'm Dr. Amit Bhate. I'm a consultant physician, a diabetologist, and an intensivist. I work in as a director in Bhate Hospital and as a director in Jeevan Rekha Hospital. I would like to tell you about Bhate Hospital. We have a 10-bedded nursing home along with lab, pharmacy with special rooms here. And I also work as a director in Jeevan Rekha Hospital. I would like to tell a little bit about Jeevan Rekha Hospital. Here we have a 10-bedded ICU setup and a dialysis center, a surgical center, special rooms, deluxe rooms, and general wards. I would like to tell you a little bit about my field, that is diabetology, which I practice. Uh, in diabetes, as all of you know, sugar works, anything you have excess usually works like a poison. So, even sugar itself is a poison if had in large quantities. But before telling you this, I want to tell you that diabetes is of two types. One is type 1 diabetes and other is type 2 diabetes. In case of type 1 diabetes, usually the patient is born with diabetes. That is from birth the patient is diabetic. But in case of type 2 diabetes, the patient develops diabetes after certain age, maybe after 35 or 40 years of age. So in case of type 1 diabetes, I would like to tell you that usually there is resistance to insulin in case of type 1 diabetes, but in case of type 2 diabetes there is there is sensitivity, there is the insulin is produced but it's not used properly because of there is resistance to that of the diabetes. So it is very important for most of the patients to know that type 1 is only just 5% of the population, but in case of type 2 diabetes it covers about 95% of the population. So we have to be very we, and this type 2 diabetes usually occurs because of our food habits, because of our sedentary lifestyle, and because how we work in day to day practice. Lot of times we are into habits of craving of large amount of junk foods. Because of this diabetes occurs most important. So this diabetes, now type 1 diabetes cannot be prevented, it you are inborn, but in case of type 2 diabetes it can be prevented. There are three stages of diabetes, that is pre-diabetes, diabetes, one is the no diabetes, diabetes, and pre-diabetes and diabetes. So you have to be very having proper thorough knowledge of diabetes before have and you have to refer to any of the consultants properly before taking any of the medications.